Hello, my name is Araceli Delgadillo, and today I will be presenting my therapeutic relationship report presentation. Today I'm going to be talking about cognitive behavioral therapy, also known as CBT, and this is a theory that I will be using to inform my counseling session. CBT is based on the theory that the problem in question is maintained by dysfunctional cognitions and beliefs. CBT incorporates both cognitive and behavior therapies. And with cognitive behavioral therapy, you assume that a behavior is learned, and when you change the environment or you change internal factors, new behaviors can result. CBT has one main goal, and that is to change patterns of thinking or behavior. And I chose CBT because it uses strategies that promote generalization and transfer of new skills and behaviors that are learned in therapy into everyday life. And these skills that are learned are able to be applied into daily life and to promote maintenance of these new behavior changes that are happening. So in my session, I am assuming that I am working with a client that has an eating disorder. The eating disorder patient counseling realm is something that I'm very interested in, and I hope to in the future be able to work in this area of, as a nutrition professional. And so CBT is the leading evidence-based treatment for adults that are dealing with eating disorders. I'm very interested in working with adult populations that are dealing with eating disorders. And when working with a client that has an eating disorder, CBT emphasizes that when you are dealing with these type of patients, you need to, as a provider, you have to provide focus on the thoughts and actions that are maintaining the eating disorder with this patient. Patients with eating disorders often hold negative or distorted views of themselves and their bodies. And these types of views can make a client feel shame, anxiety, or disgust. And it's these types of views that the patients hold that can trigger weight control behaviors and can fuel internal negative talk. So the technique that I will be using from CBT to inform my counseling session will be cognitive restructuring technique. And with this technique, the therapist or counselor, they are looking to really change the way that the client is thinking. So with cognitive restructuring, you really are believing that learned thinking behaviors can be relearned. And as you help the clients with eating disorders, you're helping to really restructure their views of themselves and their bodies. Now, as we've learned, motivational interviewing can really help enhance a theory and technique that you are using in a counseling session. And so I would definitely want to bring the spirit of MI into my counseling session with my client. First of all, I would want to incorporate collaboration into my counseling session. And when you are bringing collaboration, which is a part of the spirit of MI, you really are letting the client know that you're not taking an authoritarian role. Rather, you are both a team and you're going to work towards bringing about a change and hopefully help the client with the problem that they are facing. So I definitely want my client to know that we're a team and I'm their cheerleader and I'm going to cheer them on and I'm going to help them as they move through this process. I definitely want to express compassion. I want my client to know that I'm not judging them, that we are in a judgment-free zone. And I want them to know that I accept them, that there's acceptance. Many times, clients can feel embarrassed because of the problems that they're facing. And so I really want my client to know that I'm not judging them in any way. In my first session with my client, I would definitely want to start by identifying some of those irrational thoughts, and I would definitely want to help the client modify these thoughts as our sessions progress. I know that in the first session, you really don't get to dive too deep into the problem that the client is facing. During the first session, you really are kind of establishing a therapeutic relationship. They're getting to know you. Many times, clients can be scared off by the first session if they don't feel that the therapist or the counselor really understood them or showed empathy towards them. So I truly believe that changing destructive thinking can equal changing destructive behavior. And so this is something that I would want to achieve with my client that I'm working with who is suffering or dealing with an eating disorder. I would incorporate open-ended questions for motivational interviewing because I think that open-ended questions would help explore the internal dialogue that the client is dealing with. Obviously, the client is telling him or herself certain things that are making them behave the way that they're behaving, and that is continuing to promote the eating disorder. So I would like to explore a little bit about what is going on inside with the client. What is that internal dialogue? And I think that open-ended questions would be best suited to help me with this. Open-ended questions help the client to really think about with how they're going to answer the question. They're a lot, they can provide more information than just simple yes and no answer questions. And so I really think that incorporating open-ended questions can really be beneficial. I will most certainly express empathy, which is another component of motivational interviewing. I know that as our sessions progress, I get to know my client more. I get to know more about the thoughts that they are thinking that are allowing the eating disorder to progress. I know that emotions are going to arise that are going to be very difficult to deal with. And as a provider, I need to be able to express empathy toward my client because it is not easy exploring emotions. It's not easy to talk to someone many times about these emotions that are painful, that many times can lead us to carry out behaviors that can be destructive. So I definitely want my client to know that I will definitely be there to express empathy towards them. During the first session, and I was thinking about it, maybe it might not even be in the first session. Maybe this might happen until the second session, but I would really like my client to identify one goal that they feel that they would like to work on. I think that working on one goal would be a lot easier than to have the client write down a list of all of the things that they would like to accomplish. I think if we at least set one goal, we can be able, as a team, we can start working towards that. I think it'll just be a lot easier to set one goal. And I would also incorporate one of the 5 general principles of motivational interviewing, which is developing discrepancy. And this really allows, again, the client has established a goal, and if you develop discrepancy, it allows the client to see how their current behavior is interfering with attaining this goal. So I would ask the client to assess their current behavior that is taking place and think about themselves, how this is not allowing them to reach that goal that they have set. Discrepancy really enhances the motivation to change, and can really help the client perceive the discrepancy about the current situation and their hopes for the future. And these are my references, and I want to thank you very much for taking time to listen to my presentation on my therapeutic relationship report. Thank you.